Let's Talk NCLEX and Motivational Monday, straight from Boston Airport. I hope you guys can hear me. No matter where I am, I know I have to make time for ReMar nurses, and I'm really excited about this Monday because actually it is the last Monday before ReMar Nurse University. So that's what I have on my mind and my heart as I'm preparing for next week to be in Chicago, and then after that, just a different city every Monday. And it's going to be an amazing NCLEX tour. I don't know if you guys have ever experienced a ReMar live class, but everybody will have an opportunity to participate in this class. And that's what makes it so, so cool. So yeah, right here from Boston Airport on today. But we're going to do our Let's Talk NCLEX and Motivational Monday. I do have a thought for you guys today. Hi, hello, Michelle. I'm so excited. I'm so excited about May coming up. Good morning. This is a wonderful morning. We woke up with our minds and our hearts and our bodies and our health. And so it's very good today. Now, if you guys are joining us for the very first time, you're like, hey, who is this girl? My name is Regina Callion, and I am the #1 NCLEX instructor on the planet. And I happen to work right here at ReMar Review, where we love helping nursing students pass NCLEX. It is our passion. It is what we do every day. We have a whole team of people who love you, who want you to get your nursing license. So Monday motivation is just a small part of that. Come on in, everybody. We're getting started. Good morning. Good morning, ReMar nurses. Hey, what I noticed about the ReMar nurse family is that we are literally exploding. There are tens and thousands of us all over who are making connections. And I know I could just say, all right, for the next 5 seconds, just put what state you represent, and I would get a list of 100 states and or countries. I got it already for Michigan. I got Michigan in the house this morning. Boston, whether these people know it or not, they're about to get served my Monday motivation. So we are just growing as time progresses, and I love to see it. I got Sharita from Ocala, Florida. I thank you for being here. I'm excited about Florida. You guys know the cities I'm going to. I'm going to Chicago, Atlanta, Los Angeles, Miami, and New York, actually right in Times Square. I got Louisiana in the house, Texas, Jacksonville. Remember, even if you can't make it to the live classes, you can always watch the ReMar nurse study sessions right from your home. So make sure that you're signed up. I'll talk about it. Here's where you sign up. Go ahead right now. If you have not, go to remarnurse.com/RNU to sign up. And listen, you can choose to sign up and watch the classes totally free. You can do that, right? But what will be really cool is if you get the workbook, and once you do that, then you get POW. You get the workbook, you get your ReMar Nurse t-shirt, and you get a pen or so, all right? Also a ticket to come to the live class. Oh, this is all that I'm talking about, ReMar Nurse University. It is next Monday. It's not too late for you to sign up. It's not too late for you to sign up, okay? You can do it. You can do this. This is the last Monday that I'm encouraging you to sign up before class starts. Because, you know, if you're studying for your NCLEX exam, you don't want to miss this information that I'll be going over. And I see you guys, I see Jamaica's in the house. I see you guys are saying, hey, how much does it cost to come to the class? How much does it cost to attend the live class? To come to the live class is free, right? To come to the live class is free. What the ticket and the t-shirt gets you is just priority seating. That's all. But the whole thing, it's just really crazy. The whole thing is free. The whole entire thing. And I like that. Giselle says studying is worth it. Studying is so worth it. This is a huge investment from ReMar into you guys, because we're literally putting on this month-long NCLEX review for free. And it cost us thousands and thousands of dollars to put together. I mean, really, it did. So we just want to show you guys our commitment to you. We do it year round though, really. The Monday, oh, okay. Do you know the location and how to sign up? Okay, so let me just, before I go into this, now the locations will be revealed once you choose the city, because honestly, in my mind, I don't have them in front of me. I'm in the middle of the airport. I don't want to give out the wrong information. But when you select the city that you're coming to, then you will get the location, whether it's a hotel or a conference center at that time. So the way Mark set it up is that you go to remarnurse.com/RNU. Everybody has to go through the same process. Everybody picks that they are attending, right? Everybody puts that they are attending. Then once you select your city, if you choose to go to a live class, then you will get another email saying register for your city here, and it'll give you the location. Because it was just really crazy when everybody saw all the locations and all the cities at once. So you have to pick your city. Okay, so I have to go because I see people are getting on the plane and it's making me anxious. All right, so our Monday motivation, and I can't wait to see you guys. I cannot wait to see you. And I like that. Content wins. We are going to go over that content. Invite your nursing schools. So our Monday motivation topic is want the best for others. That is where we're going to start with this week. And for me, I am experiencing this right now, planning for ReMar Nurse University. I really want the best for you guys. And what I find is that because I'm thinking about other people, I'm thinking about what's best for other people, I myself find that I'm actually getting more of my own work done because people are blessing me back. And I like the two things that I found last week is that wanting the best for others and helping others. And I know I've said this before, but literally planning ReMar Nurse University has been so eye-opening for me. It helps me to reduce my own stressors because it helps me to literally just like take the focus off of myself. Take the focus off of myself. Yeah, honestly. So when you guys can elevate other people's needs and desires over yourself, it honestly will help reduce all the things that you can think about that are not perfect in your own world. When you can look at somebody else and see that they have a need and meet that need, you feel better about your current situation. And it gives you the fortitude to keep going so that you can continue to bless other people. Also, the cool thing about helping other people is that it really does add to your sense of purpose. It really does add to your sense of purpose. If you think that life is just about making a whole bunch of money, you are really wrong, okay? Life is so much more than that. It is so much greater than just becoming a nurse, getting a whole bunch of money, and spending it on yourself and your loved ones. You will miss out on perfect opportunities. Hey, Stacy. So, Stacy, I'm talking to you specifically. You said, hello, Regina. I'm sorry. I just found out that I passed NCLEX RN. God is good. And thank you and your entire team. It's been a long journey. Congratulations on getting your license finally. I know that feels so good. And that's what we're all here wanting, to have that feeling like, at the end of the long journey, it was worth it because I got my nursing license. And that is literally what it's about. However, during the process, you have to be wanting to bless others because it just cannot be about you. So that's what we're talking about for Monday motivation is just really expanding what we consider to be success, right? Nurse Giselle said, I passed NCLEX, believe me, ReMar works. Yes. Yes. So, yeah, when you consider other people, when you expand your sense of purpose, you will find that life is much more fulfilling. All right, just period. Now, I really like this quote, and this is going to be a short motivation as we are preparing for ReMar Nurse University. This is actually a scripture. It says, humble yourselves, then under God's mighty hand, so that he will lift you up in his own good time. Leave all your worries with him because he cares for you. That's 1 Peter 5, 6, and 7. Oh, wow. So uplifting right there. So uplifting. So again, We're talking about Monday motivation, but I can't skip out on Let's Talk NCLEX. So I do have a few NCLEX questions. Okay, are you guys ready for your NCLEX questions? Here they go. Here they go. Here they go. Okay, first one, and this is rapid fire NCLEX questions. Okay, so either you just know it or you need to come to RNU. Okay, here we go. All right, first NCLEX question. The unlicensed assistive personnel is preparing to provide postmortem care to a client with a scarlet fever. Which instruction is priority for the nurse to provide to the UAP? Number one, the UAP is not at risk for contracting an illness. Number two, the UAP should wear a mask, gown, and gloves. Number three, the UAP may skip performing postmortem care. Or four, ask whether the UAP is pregnant before she enters the client's room. Which is the priority instruction for the nurse to give for a client who has a questionable diagnosis of scarlet fever? Do you know? I'm seeing the answers come up. Great job, guys. Great. Okay, this is rapid fire. Let's talk NCLEX right now. Everybody seems to be on the same page here. The correct answer is actually, you guys got it. Yes, the UAP should wear a mask, gown, and gloves. This is the most important. And when it comes to protecting yourself, if NCLEX is an exam based on client safety, you have to know how to isolate clients appropriately to protect yourself and other patients. So great job. Let's do the next one. Here we go. Which client should the nurse see first? All right, this is my favorite type of question, easy priority. Who should the nurse see first? Number one, the client with kidney stones who is reporting severe flank pain, fever, and has hematuria. The client with disseminated intravascular coagulation who has blood oozing from their wound site. The client with benign prostatic hypertrophy who is complaining of frequent dribbling of urine, or for the client with Cushing's syndrome who has a potassium level of 3.0 and hyperglycemia. Oh my goodness. Which client should the nurse see first? Got a lot going on with these clients. All right, number one has kidney stones. They're reporting, I should say, severe flank pain, fever, and hematuria. Two, the client with DIC who has blood oozing from their wound site. Three, you got a client with BPH who says that they have frequent dribbling of urine. Or four, you have the client with Cushing's syndrome. They have a potassium level of 3.0 and hyperglycemia. Who do you see first? And remember, I hope you guys are coming to RNU because I'm doing prioritization. And this is definitely a classic prioritization where airway, breathing, circulation just does not come up here. Okay, and you have to know how to do these. The correct answer, actually, you may be surprised. Yeah, it's number one. It is actually the client who has kidney stones right here. And can anybody think of why number one is the correct answer? If you look at it again, why is number one the correct answer? This patient is your priority because they're having an abnormal assessment. So they have severe flank pain, okay, with the kidney stones. But why are they having fever and hematuria? What's going on with that patient? What is going on? We need to figure it out. The client number two who has DIC, well, they have blood oozing from their wound site. Would we expect that with the client? Would we expect that? We would. What about somebody with BPH who is complaining of dribbling of urine? Yeah, I'm going to expect them to have that issue because their prostate gland is enlarged. What about the client who has Cushing syndrome and they're having a low potassium level? Is that abnormal for me? Am I worried about that? And they also have hyperglycemia. Is that abnormal? Nope. That is going to be pretty common. So with prioritization, we need to look for the client who is the most unstable, who has the abnormal medical assessment. And the way that you know that is by studying your content. That's it. That's it. You're not going to have any decision trees or test taking strategies to be able to understand these types of principles, right? So it's important for us to focus on the content. I like how the nurse said it, the future nurse said it. She said, content wins. Content wins. That's so true. All right, I think I have one more question for you guys. Okay, here we go. The clinic nurse is caring for a client diagnosed with osteoarthritis. The client tells the nurse, I'm having problems getting in and out of my bathtub. Which intervention should the clinic nurse implement first? Okay. Clients having trouble getting in and out of their bathtub. Which intervention should the clinic nurse implement first? Okay. Number one, we have determine whether the client has grab bars in the bathroom. Two, encourage the client to take a shower instead of a bath. Three, initiate a referral to a physical therapist for the client. Or four, discuss whether the client takes NSAIDs, which are non-steroidal anti-inflammatory drugs. So if a client says, I'm having trouble getting in and out of my bathroom, what is the priority intervention should the nurse implement first? Okay. Number one, determine whether the client has grab bars. Two, encourage the client to take a shower instead of a bath. Just say, hey, just stop taking baths altogether. Just take a shower. Three, initiate a referral to a physical therapist. Or four, discuss whether the client takes NSAIDs. And I see the answers coming on in. Come on in. The correct answer. Yes, I like that. I like that, Nurse Sweeney. The correct answer is number one. You need to determine whether the client has grab bars in their bathroom. You have to do an assessment first. You have to determine whether the client needs an assistant, because maybe some simple grab bars will help them as opposed to writing up a whole recommendation for PT. Okay, so you guys have the idea. Yes, you have the idea. I think what is most important is that we continue to review and do questions. We continue to review and do questions. So continue studying with me. I love studying with you guys. It's the highlight of my Monday. Okay, it's the highlight of my Monday. If you have any questions about RNU, how to sign up, how to register, please email me, support@remarreview.com. There's just a few days left. Everybody who signs up today, up until, I think Mark said up until Friday, you can still get your ReMar Nurse University workbook, your t-shirts, plus the discount code, okay? I know my plane is going to be gone. I'm going to come back in 5 minutes like, you know what, guys? I'm here all day, so we just got to keep studying how I miss my plane. But no, I'm trying to really encourage you guys. Sign up, okay? It's not too late. This is going to be an amazing class. And whether you come to the live city and meet me, which I'm really looking forward to, or if you stay home and watch it from home, either way, every Monday, 7 o'clock for the local time zone, you will be able to study with me. Also, if you've been waiting to purchase the self-study package during ReMar Nurse University, you will be able to get $100 off that package. So it's a huge discount opportunity for you all. I'm just super excited. I'm super excited because the information is going to be so good. And you guys that are studying, you will get to see how I study, how I look at information, because there's a lot of information. Okay, so before I leave, you guys know what we got to do. I Thank you so much for spending a little bit of time with me before I board this plane. Here we go. We can, we will, we must pass NCLEX. Say it with me this time. Say it with me. You missed it. We can, we will, we must pass NCLEX. See you guys later. I love you so much. Pray for me while I'm on this flight, that when I get back, we will be able to continue studying, and you will see me in your city if you are in Chicago, if you're in Atlanta, Los Angeles, New York, or Miami. I'm so excited about RNU. Hello. Okay, so I see this question. Can you watch after? If you miss it, if you miss the 7 p.m., you got to catch it, okay? You just got to catch it. But I do believe that we will definitely keep it up so that you guys that are working, if you missed it, you can watch it again. I know you like to listen to things over and over and over again. So yes, Nurse Napoleon says, I passed NCLEX last month, but I still can't leave ReMar alone. Regina is the best, guys. Just follow her and you'll be successful. Thank you so much for that. I really appreciate you guys that are nurses coming back, still studying, still encouraging the ReMar family. That's what family is for. Okay, guys, I have to go. Turn me loose. You guys have to turn me loose so that I can go. All right. God bless everybody. We can, we will, we must pass NCLEX.